What is first aid? When you see somebody who is injured or sick, you can provide first aid. This can save lives and make a difference in recovery. Don't worry about doing anything wrong, really everyone can do it. In this video I will explain you how to respond to different situations. First, before you make an emergency call, check the location of the emergency. Look for the number of injured people involved and how they behave. The second priority is to mind your own safety. Try to gain an overview. Look for dangerous substances, high voltage, heavy traffic and risk of infection. Make sure not to risk your own life. The third step is to do an emergency check, which I will explain later. If you can make a phone call, you should immediately call emergency services. In Europe, you dial the number 112. If you are deaf, quickly find someone hearing and ask them by typing or writing on your phone to call 112. Also add the information about the incident briefly and clearly. If the injured person is conscious and can talk, you can type on your phone 112 and give it to them to call. It is important to call as soon as possible. For the call, these details are important. What happened? Where is the incident and how to reach the place? The number of people that are injured. Which dangers are present there? Do not hang up too quickly. The service operators can still have questions for you and give you instructions on how to help. Now I explain how to do the emergency check. See and check if the person is conscious. Talk loudly to them and tap the person and check for reactions. To make sure the person can breathe, you need to clear the airways. Stretch the head back, pull the chin upwards. To check for breathing, hold the head back and put your hand close above it. You can feel the breathing on your cheek. Look at the chest for movement. These 4 measures are always right. Check the vital functions, check the breathing. Call for help. Take care that the body temperature remains normal. Provide comfort and keep checking till the ambulance arrives. Here's the situation. If someone is unconscious, the person does not react to you at all, but is breathing. Then you should immediately call the ambulance and put the person in the recovery position. Here's how. Kneel on one side of the person. Extend the arm nearest to you to the sides and put the other arm under their chin. Take the leg on one side far from you and bend it. Carefully roll the person onto their side by pulling on the bent knee. Tilt the head back and open the mouth slightly. Check if the mouth is laying low. But if the person is not breathing, you need to do cardiopulmonary resuscitation. Doing CPR early can make the difference for them to survive. Resuscitation can prevent brain damage and death. Place your palm in the middle of the ribcage, put the second hand over the first and push on the breastbone. Push in a rhythm like this. Push vertically with extended arms 30 times. Then give 2 rescue breaths. Close the nose, pull the chin upwards and give the breath like this. Then 30 times resuscitation and do it again. In a different situation, a person can also have trouble breathing when the airways are blocked. This can happen when a piece of food gets into the airway. Give 5 hits on the back between the shoulder blades. Hit with the flat hand while the person leans forward. If this does not work, do 5 upper abdominal thrusts, also called Heimlich maneuver. Position yourself behind the person. Place your arms around their waist, make a fist and place it just above the navel. Grab the fist with your other hand and push it inward and upward at the same time for 5 times. Then give 5 hits on the back. Repeat until the object comes out and the person can breathe again. When helping someone that is injured, first check for wounds. These come with 3 dangers: blood loss, extreme pain, and high risk of infection. When you help a wounded person, it is best to wear gloves and apply a new bandage. Every household, car and organization has first aid kits with suitable bandage material. With severely bleeding wounds, the injured part should be held up, then put on a pressure bandage. With big foreign objects stuck in the wound, a bandage can be placed over it so that the padding reduces the pressure on the object. Avoid touching the foreign object in the wound. Additionally, you should check if the person has swelling and pain in muscles, bones, or joints. If so, these body parts should not be moved and must be kept as still as possible. Cool them with a cold pack if you can. Repeatedly check the vital functions. And do not forget to make the emergency call.